Hello, ladies and gentlemen. Welcome to Smart City Dialogues on the ETGovernment with me, Radhakrishna. Today's my guest is Dr. Renu Raj, the Directorate of Urban Affairs of Kerala. Dr. Renu Raj belongs to the 2015 IAS batch of Kerala cadre. A doctor by profession, she left her medical practice to achieve her dream of becoming an IAS officer. The Directorate of Urban Affairs is a concern with the administration of municipalities and municipal corporations together called urban local bodies in Kerala. There are 93 urban local bodies in Kerala, including 6 municipal corporations and 87 municipalities. The Department of Urban Affairs functions under the Kerala Municipal Act 1994, which is a unified act for municipalities and corporations based on the 74th Amendment of the Constitution of India. The Directorate is the inspecting authority in respect of all bodies. The Department of Urban Affairs, headed by the Director of the Urban Affairs, is the overall controlling authority of the municipalities and municipal corporations in Kerala state. What is the status of smart cities in Kerala? And what about the ongoing urban reforms in Kerala? Dr. Renu Raj joins me from Thiruvananthapuram, Kerala's state capital. Ma'am, welcome to Smart City Dialogues. Ma'am, following the COVID-19 pandemic, local government institutions are rising to the occasion and creating adequate resources for self-sustenance. What has been the Kerala's experience in adopting reforms? If any technology initiatives, please elaborate.
Yeah. So as you are aware, the various projects of local self-governments, including the centrally sponsored schemes, all of them are envisaged to be performed or completed in a time-bound manner. So the COVID-19 outbreaks have actually severely disrupted the timelines of implementation of many of our schemes, especially because of, especially the construction projects were much challenged because the workers, they cannot work from home. And, the contractors, the subcontractors, the supply chain vendors, everyone experienced varying degrees of impact as a result of the pandemic. So to overcome the delay, the state as well as the local bodies have been directed to follow strict COVID-19 protocols, but along with that, restart their works and reschedule their works as per the new situations. So this COVID is a continuously evolving problem. We need to learn to live with it. So regulations and guidelines have been given to them to adapt to the changing situations. And now the restrictions have been relaxed a bit, allowing construction and related regular projects to restart. Situations are very different from it used to be, but then since the strict lockdown and things have come down, we have given specific directions how we can go ahead. For example, we have focused a lot on IEC activities, educating the general public through the local self-governments, as well as when it comes to implementation of projects. We have done a lot of IEC among workers. And we have ensured social distancing, both in public gatherings as well as, in various projects and working groups. We have ensured the use of face masks. Almost 100% of the population now in Kerala use face masks, and strict enforcement is done with the help of Jagrita Samitis, which are formed by the local self-governments as well as with the help of police. We have also made adequate arrangements so that there are no big gatherings. There are restrictions in occasions like marriages and get-togethers. And also where project implementation and constructions happen, we have ensured as much as possible that the workers get a shelter within the premises of the construction area so that they don't have to go out and mingle with the rest of the population, putting them at risk of contracting the disease. And then we have also disseminated a lot of information on the pandemic. We have ensured health checkup wherever there is a vulnerable population, for example, the physically and mentally disabled, their homes, the elderly, And we have also done a lot of work in ensuring the mental health of people who are strictly quarantined at home, mental checkups so that they don't fall into depression or have any anxiety disorders. So these are the various methods that we are adopting right now to ensure that a kind of normality comes back to the lives of people, as well as our projects, especially our works related to construction and other things, restart and get back to the early normal.
Thank you, ma'am. You have two smart cities under Smart City Mission. One is Kochi and the second is Thiruvananthapuram.
Yeah.
How did they cope up with this pandemic, and what are the major contributions in supporting the local people and also local government institutions? If you can elaborate.
Yeah. So as I already said, both these smart cities were also hardly hit by the pandemic, but they have now risen up to the occasion. In addition to restarting their normal works, they have also contributed immensely to help the local public during the pandemic. For example, we have two smart cities. One is in Trivandrum and the other is in Kochi. Trivandrum, as you're aware, has got a long coastline with a lot of coastal population, which is inhabiting very close to the city. So Smart City Trivandrum has participated in controlling the outbreak of COVID-19 in the coastal areas. They have helped with the supply of essential items, collection and dissemination of information related to COVID patients, and passing it on to various departments like the health department and local government department. So some of these operations were performed by them. And then in addition, they have also developed a dashboard which helps the administration to, the monitor and regularly look into the progress of the disease as well as the containment activities. They have also initiated various social media campaigns so as to disseminate information to the public. And in addition, wherever the works of Smart City are being done, they have ensured checking the body temperature at the entrance, providing sanitizers and masks. They have also kept various vending machines like sanitizer vending machine and mask vending machine in front of public offices, and they're planning to do it more in places where people gather a lot. And when we go to Kochi, Kochi has already got a fully functional ICCC integrated command control center, which actually acted like a war room for gathering all the information, coordination and monitoring of activities related to COVID. And it helped in, monitoring the availability of oxygen stock, the availability of beds, the conditions of patients across government as well as private hospitals all over in the district of Ernakulam. So this data in the command control center was updated by the field staff and the hospitals regularly. And it really helped in making helping in a real-time decision-making of the administration.
Thank you, ma'am. Ma'am, to maintain discipline in finance management, especially in local bodies and local governments, municipal bonds are generally, India has introduced. Some of them already announced. Are there any plans with the Kerala regarding municipal bonds? Any public-private partnerships that you have giving a more trust? If you can elaborate on both these ideas.
Regarding municipal bonds, as of now, no local body in Kerala has floated municipal bonds. But yes, some preliminary measures have been started. For example, with the initiative of Amrit Mission, Atal Mission for Rejuvenation and Urban Transformation, there are 9 Amrit cities in Kerala. So, preliminary assessment of their capabilities and their readiness to float municipal bonds that study has already been completed in all the 9 cities. And 2 of our cities, Kochi and Trivandrum, have achieved a status where they can float their bonds. And with respect to Kochi Corporation, the council is already in the process of floating the municipal bonds, and we hope that some action will be taken within the maybe coming couple of months. And regarding public-private partnerships, this is one thing that we have been actively promoting especially in the case of operation and maintenance of a lot of big projects like centrally sponsored schemes. So these are also in collaboration with all the activities that I already mentioned. So yes, these are the areas where we need to focus a little more, but we expect that in the coming few months, we'll be able to see some good results in this regard.
Thank you, ma'am. Ma'am, we have witnessed, SCADA is being part of the water management and electricity also. And there are reforms in power sector also. Prepaid smart meters are being implemented across that. So in nutshell, in urban transformation is really taking a big shape with the reforms are in place. In Kerala, I'm sure, as a young IAS officer, you must have a lot of enthusiasm to introduce the best practices in Kerala too. Being a progressive state, what are the reforms level of maturity level of reforms taking place? If you can highlight on those things.
Yeah. So one thing that we are focusing, the state government itself is promoting the use of LED bulbs for all the public street lights. So a project in this regard is already underway. So a lot of municipalities and corporations have already chipped into this. This is a program in which the ultimate aim is to replace all the incandescent bulbs that were being used into LED bulbs so as to ensure energy efficiency. In addition to this, as the initiative of the smart cities as well as in Amrit cities, in order to enable these cities to achieve the sustainable development goals, so further work in areas of health, transport, implementation of e-governance, disaster management, especially in flood mitigation, because we faced 2 big floods in 2018 and 19. Then environment protection, because we have issues related to the Western Ghats on one side and the ocean on the other side. So we are ecologically a very sensitive region. So related to environment protection, like tree mapping, surveillance, and utilities at pan-city level, such as smart meters that are being introduced in smart city project, smart water meters. A project was introduced called Water Efficient Thrissur, WET, under the Amrit scheme in Thrissur city, in which there is a real-time monitoring of water supply throughout the city and the functioning of water meters. And the city corporation will get real-time alerts whenever there is a leakage of drinking water pipes, or if some meters are not working, real-time alerts will be given. So such water meters were introduced. We are also thinking about smart parking by using multi-level car parking systems which use modern technologies. Like you don't have to drive through, but your vehicle will be, you park in the parking lot in the ground level. Your vehicle will be automatically taken to an assigned parking lot, and then it will be taken back to the level when you re-enter your card, which you get during the parking. So these kind of smart initiatives are underway. We are also in the process of discussions with various NGOs and international organizations, which can help us in bringing in more modern technologies to our smart cities as well as all other towns and cities in the state.
Okay, thank you. The smart cities and departments of urban affairs are pursuing next generation technologies as a future opportunities, which are, if I may ask you, your next potential domains for your smart cities and also urban development. Since Kerala recently introduced electronic vehicles for the government employees, EV infrastructure is really important. Do you see that urban department or smart cities maybe perhaps can play a significant role in setting up the EV charging infrastructure?
Yeah, definitely. We have developed a department called UNERT, which is promoting use of e-vehicles and other features which reduce the use of fossil fuels. So as you rightly pointed out, now there is a system in place which provides e-vehicles to departments which can be used by officials at fixed cost, and this is like a package which includes the driver as well as the rent for the vehicle. So that is being widely used right now, but we also need to focus on passing on this idea to general public so that they are also aware that such a facility is available. And when we think of the supply chain, when the demand rises, we also need to provide charging stations, fuel stations, where people can get the vehicles charged hassle-free. So in this manner, the local governments have a great role to play to ensure that at the right points people get the charging facilities, and the information about this is being passed on, especially in big cities like Kochi, Kozhikode and Thiruvananthapuram. There is a great future for e-vehicles. It will also help us in reducing the fossil fuel consumption. So yes, we are thinking about it. We have at the government level as well as at the local body level, we have introduced new plans regarding this. And in addition, one area we are focusing, especially in the backdrop of the pandemic, is transforming the health sector into the e-health sector. The e-health portals have already been introduced in many major hospitals like the regional cancer centers, which are 3 in the state. We are trying to expand it to all government hospitals in the near future, and thereafter we already have a very strong private network of healthcare institutions which have a lot of next generation facilities like e-health and things. So we need to collaborate and bring them also into the system. So once we complete expanding this e-health system into all government hospitals of the state, we'll also be integrating the private hospitals so that a patient going to any one hospital anywhere in the state, his records and medical details, if required, are available at any point of time in case of an emergency for him. So we're thinking in that level also.
What about telemedicine facility that?
Yeah, this is one thing that has really worked well during the pandemic because, people especially having non-communicable diseases, there was a difficulty for them to go to hospitals for fear of the disease, fear of COVID, and it was not safe for them to travel outside, especially the elderly population. So through the e-Sanjeevani portal, lakhs of people have actually utilized the opportunity for telemedicine. Especially for non-emergency diseases, non-communicable diseases, long-term diseases, and all. This has been in use widely over the past 1 year. As a part of e-Sanjeevani, we also have a e-mental health portal where I earlier pointed out, like especially children and elderly people who are not able to go out of house and have been restricted to their homes for almost 2 years now. They are also widely utilizing this facility to get counseling and treatment if necessary. We have also connected this portal with a lot of volunteers. Like, for example, after a consultation, a teleconsultation, if the patient requests to purchase some medicine, these volunteers will be of help. These volunteers are attached to the concerned local self-governments, and if the patient if the person gives a phone call to the call center in the local self-government, the help desk, they will assign a volunteer who will purchase the medicine and provide it at the doorstep. So these activities are also underway.
These war rooms or integrated command control centers become really handy during the pandemic and also during the floods also. Do you have any plans? Similar infrastructure can be facilitated or make sure that they are available in all the district headquarters as part of urban department's mandate?
Yeah, so at present, the system is that other than in the smart cities, all other district headquarters have got district emergency operations center or the DEOC, where all departments will have one designated officer each present there in times of any emergency. Even in times of no emergency also, there are few designated officers who will be available there at 24/7. So these are located in the district collector offices of every district. But like the ICCC, where technology is also been ingrained into the system and there is a real-time monitoring, this has to be expanded to all the other district headquarters. The disaster management department is already in line of thinking about this and trying to chip in technology providers and funding for this. But the concrete plan of it is yet to be formulated. But yes, definitely in the coming future, we'll be thinking about it.
Ma'am, my last question, ma'am. What should be 2 key focus areas for an administrator like you, especially heading the Department of Urban Affairs, in the next 6 months, especially for Kerala, if you can?
The key focuses for the upcoming 6 months will definitely be one, completing all our stalled projects, especially our big projects under the centrally sponsored scheme, and also by the State Department. We have delayed a bit because of the pandemic and various issues faced by it. So we have arrived at new timelines which need to be completed on time because life has to go on along with the pandemic. So that will be one focus. And the second will be providing enhanced support to the state administration in managing the pandemic, especially through initiatives like IC4 and other technological interventions. So these will be the 2 key focus points for us in the coming 6 months' time.
Okay, thank you, ma'am. Ma'am, one supplement question. Of course, many private organizations love to work with government institutions. There's no exception for Kerala too. Do you have some projects which you think, according to you, or these are the private-public partnership potential domains which we are open to private parties like that? Do you have any such priority list?
Definitely one area in which the department is keenly interested is the waste management, both solid and liquid waste management. We have already started with some projects of waste to energy plants, almost 5 of them in different parts of the state, but all of them are in their inception stage. And regarding liquid waste management, also we have projects in line to be started, especially under the centrally sponsored schemes like Amrit, as well as the World Bank project that is coming up in case of waste management in the state. So this is one sector where we need partnership, not just in funding, but also the technologies from private players, which I think would really help the state to take forward the projects so that, waste management is one issue that we are facing for the past many decades, and we are yet to find a permanent solution for it. So this is one area where the urban department is keenly interested in having private players coming into play along with the government.
Ma'am, thank you very much for talking to Smart City Dialogues and sharing your insights with us.
Thank you. Thank you so much.